the JAMA Network.
Antibiotics are critically important drugs.
Very powerful antibiotics are being used in situations you wouldn't normally expect them to be used, which suggests there's probably room for improvement to eliminate unnecessary antibiotic use. Unnecessary antibiotic use is one of the key drivers for the development of antibiotic-resistant infections.
Dr. Shelley McGill and Scott Friedkin from the Centers for Disease Control and Prevention and co-authors conducted a cross-sectional survey of 183 U.S. hospitals. From May through September of 2011, each hospital selected a specific day to report on what type of antibiotics hospitalized patients were receiving.
1 out of every 2 patients that were surveyed was on an antibiotic. About half of all of the patients on antibiotics were getting 2 or more antibiotics.
This study appears in JAMA, Journal of the American Medical Association.
The very most common drug overall was a drug called vancomycin. When we looked at the most common antibiotics that patients were getting, we did find that they tended to be what we call broad-spectrum antibiotic drugs.
Broad-spectrum antibiotics, which are used to treat more resistant infections, were not only given to patients in the intensive care unit, but prescribed commonly in regular medical and surgical units, and also for infections that began outside the hospital in the community.
The line has really blurred between reserving these powerful antibiotics for patients that have healthcare-acquired infections and those that have community-based infections.
That might be an opportunity to look more carefully to see if there are ways in which use could be improved in those specific settings.
To help accomplish this, last March, the CDC asked every U.S. hospital to implement an antibiotic stewardship program.
Having a stewardship program that's got leadership, accountability, drug expertise, monitoring and tracking, that's a program that can make a difference for all of the providers that prescribe antibiotics in hospitals in the U.S.
Catherine Dolf, the JAMA Report.